Welcome to the reality of back to school in COVID times. In the light of this global pandemic, back to school 2020 is unlike anything the world has ever experienced, and we all know that. As 1,253 schools, both private and public, across the UAE, reopen this week and some of them reopening next week, we'll take a look at what this means for key stakeholders. And who are they? The public, that's yourself, educational institutions, healthcare entities, and government bodies. So we want to know what everyone's thinking and feeling at this point in time. So that's what this panel discussion is going to be about. I'm Shireen Saif. I'm the moderator of this panel discussion, and it is my pleasure to welcome the panelists. So please allow me to introduce them to you. Sangeeta Chima. She's the principal of Amity School, Dubai. She's an educational practitioner with 3 decades of experience. She has served as school leader for institutions including the legendary Lawrence School, Lovedale, and GEMS New Our Own Private High School. Sangeeta, thank you for joining us today. We have Dr. Kiran Hillier. She's an assistant professor of psychology at Heriot-Watt University, Dubai campus. She also has a private practice providing psychological therapy to adolescents, adults, and couples. So she's actually our teacher and psychologist in one. 2 people in one. Thank you, Kiran, for joining us. Kadir Pir Sharif, the gentleman right in the middle, as I can see in his blue jacket, is a multi-award winning technocrat with over 23 years of experience. He held senior management positions at Tata Group and ICICI Infotech before taking on his current role as CEO of Gibraltar Technologies. Thank you for powering today's Back to School webinar. Thank you, Sharif, for joining us.
My pleasure.
Dr. Sally. Dr. Sally is joining us all the way from Prime Medical Center. She's a family physician there, and she's right now at the nurses' ward. Is that right, Sally? She is a COVID specialist, and you can see that she's wearing a mask because she is in a high-risk area. She was recently awarded by His Highness Sheikh Hamdan for her exemplary work as a frontline doctor. Thank you, Sally, for joining us. I know you're extremely busy. Thank you for making this happen. It was important to have a doctor's perspective on this. Thank you, Dr. Sally. Gigi Thomas. Gigi Thomas is the IT head at Etihad International Investment Abu Dhabi. He's a winner of the SAP Quality Awards 2020 UAE in the Cloud Transformation category. Gigi is also the founder of The Desert Farmer. Everyone can grow their own food. Well, today he's on board as a parent of 3 children, 2 school-going ones, 1 10-year-old and 1 4-year-old, and another 6-month-old. So you're taking the parent role today. Thank you, Gigi, for joining us. And finally, we have Purva Grover. Purva is a journalist and author of The Trees Told Me So. If you haven't read that book, please buy it. She'll tell you where to get it. She's also the founder editor of the Indian Trumpet and editor of Khalij Times Young Times, which is a magazine for young adults. So she's going to be the voice of the children. So there you go. You've got all sorts, you've got panelists from the school side. You have a psychologist, a teacher, a parent, a doctor, a journalist, and the technology man. And we're ready to launch. Now, I hope everyone's received the poll and everyone's filled out the poll, because we will be taking a look at the results of that poll shortly. But in the meantime, I'm going to invite the panelists for their open remark. I'll start with you, Purva. Share with us your thoughts on going back to school.
Okay, thank you so much for having me here. And since I'm here representing the kids, so I have selected 2 poetic pieces that they have sent to us, and I'm going to read those because I'm representing them. So what better than their words? So the first one is by a 10-year-old, and this is how it goes. I used to go to school, and I felt it was so cool. We students used to be excited, and the teachers delighted. But now we live in the era of e-learning. A desire to go back to school is burning. It's been weeks of distance learning, and for so long I've been earning for the school of joy at learning. I feel that life has become dull and we are all stuck in a lull, but we should continue to be hopeful that we'll soon bounce back and again be joyful. So that's the first one, and I'll quickly read the second short one as well. Bricks, cement, and classrooms were once in fashion, but schools can exist as long there is spirit and passion. Learning is learning, even if remote. Initiated by KHDA, it gets my vote. We've started remote learning. In a way, our life is now turning. During the virus, we are learning happily using devices. I miss my friends and going to school, but Google Classrooms and Zoom sessions are way too cool. Our school teams are working night and day to ensure that our learning goes on the correct way. Our teachers are taking a lot of pain, and we are going to do our best and not let their efforts go in vain. We, our parents, school, and KHDA, we stand in this together. So that
was
one
wonderful. Thank you, Purva. How old are these children?
So the first one was by a 10-year-old and the second one was by an 11-year-old.
Okay, and they're yearning to go to school, is that right?
Yeah, but they're very happy with the cool Google Classrooms and Zoom sessions.
Okay, I'm going to go straight to the parent. Gigi, we're going to take the parent's opinion on going back to school.
Sure. I think, thank you everyone for having me. And I think I'm just going to throw in some numbers. It's going to relate to very much what Purva said, but with a little more statistics. The COVID-19 pandemic has created possibly the largest disruptions in our education system's history. It affected 1.6 billion learners, 190 countries, and almost all continents in the globe other than Antarctica. The closures of the school, the learning spaces have impacted 94% of the world's student population and up to 99% in the low and middle income countries. Now, this is facts on one side. Now, on the other hand, this crisis has stimulated innovation within both the education sector as well as the parent community. We have seen innovative approaches in support of education, whether it be through radio, through television, through internet packages. Distance learning solutions, collaboration tools were developed. What did this mean for parents? For parents, it's new learning and teaching methods, new time management methods, how to split my time from my first one to the second one to a bottle feeding baby, how to divide my time between the children and the teachers and my workplace, finding a right background to talk from, the right lighting where everybody can see us clearly, keeping the children apart so that they don't interrupt or disrupt each other's sessions. So there is a whole new mode of evolution, new norms that we have learned and adopted in the last 4 to 6 months. This is from a parent.
Thank you so much, Gigi. So new ways, new days and new ways, huh? So lots of learning, both for parents and children and for all of us. I'm going to go straight to the school perspective. Sangeeta, we'd like to hear your voice on this.
Oh dear me. Oh dear me. Lovely to hear poetry. I can feel a zeal of romance there. And Gigi, the parent, you are the main stakeholder that I would love to embrace virtually. We've got 5 days to go. And the situation is overwhelming. Let me tell you, as a school leader, as a person who's been handling and meeting and interacting with teachers over the last 6 days. So we are here flying. We are airborne. We are flying. We are airborne. And believe me, we are still writing the blueprints. So we just don't know where we're going, into that completely unknown territory. God keep us safe, inshallah.
Okay, that was kind of very suspense-filled. We'll have to see what the future looks like, but then I guess that's what it is. But I'm assuming that you're excited about all these new things that you've set in place.
It is overwhelming to an extent that I feel whatever we've done is going to be a good success. Right. Much more than that. Right. Much more than that. But there is this feeling of suspense. It's true adventure. You really want adventure, this is it. You don't have to try and go.
Yeah. So it seems like both for the, for all three stakeholders, whether it's a child, a parent, or the school, it's going to be an adventure. It has been and it will be. I'm going to take a comment from Dr. Sally. Dr. Sally, what would you like to say in brief about going back to school?
Actually, it's very important. I encourage to go back to school. actually, as a doctors, as a team in the school, everywhere, like they are following the instruction from the ministry and from the Department of Health. So there is an instruction for everything, and it is under instruction, and they are watching the children, because the danger of not attending the schools more. So what I'm encouraging, first of all, we should just advise the children to visit their pediatrician before attending the school. Okay, first of all, it is important to check the child well-being, the child health. Okay, and also to give them idea about what is the meaning of the corona, and what is the precaution they should take. I'm against the online study, because there's a lot of things that's happening. There is no social interaction. There is no self-confidence where they can build in the school. The obesity from sitting the whole day in front of the computer, because most of the kids I'm seeing like sitting on the computer after they return from the school, but now from morning till night they are in front of the computer. It's affecting their mental health, they're affecting the brain, affecting their eye, the obesity, everything. There's really more effect from the virus on the children sitting at home. So I'm totally encouraging attending the school.
Thank you so much, Dr.
And
Sally.
there is simple precaution. Yeah.
Yeah, I will come back to the precautions and all of the other in-depth as we go to the panel discussion. I'm going to go straight to Dr. Kiran Hillier. What are your comments on this?
So speaking from both the perspective of a psychologist and a university lecturer, I think something that we really need to consider as we're moving forward is no singular approach is going to be, there's no one-size-fit-all method. No singular approach is going to suit every country or every school or every individual student. What is important in terms of students' both mental well-being and their academic performance is that they need consistency, they need stability, and they need an environment where they are being reassured by the people around them, be it teachers or parents or other caregivers, that whatever happens, they are going to be okay. Children are extremely resilient, but what's important is setting that mindset of the child, the parents, the teachers, the school administrators, that whatever approach we end up deciding to take in consideration of the needs of our unique set of students, they're going to be successful and things are by the end of it. Mindset's going to be really important moving forward.
Okay, thank you so much. I think that's that hasn't been spoken enough, the right mindset about going into this thing. Thank you, Dr. Kiran. I'm going to finish up with the technology man. Sharif, what are your thoughts on this?
Actually, any particle of matter in the universe attracts any other with the force varying directly as the product of the masses and inversely as the square of the distance between them. Any idea what this is? This is Newton's law of gravitation. Now, if you're wondering what has this got to do with the pandemic, okay, this is year 1665. That's where there's an outbreak of a bubonic plague that happened. And year 1665, our young Isaac Newton, he was in Cambridge University at that point in time. So he had to come back to his hometown and he visited his orchard. And that's where the apple fell down. And then we all know what happened in our physics class at that time. Yeah. And I also want to talk about Dr. S. Josephine Baker. She was the first woman to earn a doctorate in public health from the New York University. The Spanish flu outbreak was in 1918. At that point in time, she was the director of the Department of Health. And absenteeism in school was very high at that point in time. And Dr. Baker argued kids were better off contained in schools and that regular medical inspections could identify sick students and keep healthy ones safe. In fact, she ensured a system of inspection and examination enforced, which then was followed by many other states there. Dr. Baker was actually called a leading progressive reformer. what you're trying to say here is whether it's going to be an inline class or offline system, each has its own advantages, especially during this unprecedented times, challenging times. We need to take positive out of these things. So I guess the whole webinar is just a topic of discussion about whether to go to online classes or inline school, and not for any decision making. So I guess we will take the positives and move on to this.
Yeah. Thank you for that. I think dipping back into history to say that this is not the first time that a pandemic has actually hit parts of the world, but how people have turned that pandemic around, creatively coming out with solutions. I think this is almost a chance for us to look at it like that. So I'm going to launch straight into the results of the poll. We did an audience poll right now, and the question was, are you planning to send your children back to school for this coming academic year? We have 41% who said no, and 28% maybe unsure, obviously, because they have much to consider, and 31% were confidently saying yes. Let's keep it at that, and let's proceed with the discussion. Obviously, parents need to take informed decisions, and this webinar is not really about telling you how you should proceed with either sending your child back to school, going with a blended, or going online. This is really not about that. It's about sharing opinions and for you to make the right and informed choice. That's entirely yours. So let's launch into a similar survey that was conducted earlier last month. A recent YouGov survey that covered 500 respondents across the UAE revealed that over 60% of the parents in the UAE are willing to send their children to school. So that's 60% were willing to send their children to school. 43% preferred blended, as in person and online. 25% were advocating online learning only. Clearly, the entry poll here shows a slightly different opinion, but we're looking at 500 people versus 67 people who are participants. But what I want to do right now is to take a quick show of hands from our panelists to see how many people say yes to going to school. Can I see a show of hands? If you say yes, raise your hands. What do you think about sending children to school? Is that a yes? Ooh, no yeses. Okay. Okay, that's 2 yeses. No's?
You are expecting from whom?
From the panelists. What is your
okay.
opinion? If you say yes, I think Dr. Sally says yes. So that's Dr. Sally.
2 years.
2 hands. 2 hands. Okay. So that's the doctor herself saying yes. We have Sharif saying yes, and we have the school saying yes. Are the others all maybes or no's? Is there a no in this group? You say no to children going to school. Okay, excellent. So I'm going to start with the people who say no. Okay,
and
so you're
I'm
a maybe. You're a maybe, I see you. Okay, so I'm going to start with why the parent is unwilling to send the child to school. Gigi, I want your opinion on this. You need to unmute your mic.
Yes.
Yeah.
So I would have been a more willing parent, and I think this is a little more specific to me and my situation. So I need to give a background of what's happening. So I have 2 kids at school. I have a grandparent who's at home, who's 65 plus. I myself, I do undergo some of, for example, hypertension medication.
Mm-hmm.
So, and I believe many of the parents or the community who is in this country could be encountering similar situations. So the challenge is not necessarily specific just to the well-being of the children, because if that was the case, I'm sure you would have seen a lot more yeses. I think the concern is a little beyond that. I think it's also of the well-being of the parent and the elderly who is there at home. And there is some nervousness and fear of what could be a situation, because we've all seen studies and reports that the children themselves are more resilient to these attacks and that they are able to fight through, and their immunity is way better than those of the higher age group, which is back at home. But I believe the fear factor is about the health risks, about what would happen to this community, and it's more about insulating that community. And this is the situation that's specific to me. That's one, and this could be varying across different parent communities. My other concerns are, can children or a certain, now I have a son who's 10-year-old, okay, and I know that he would follow instructions, but can my 4-year-old child follow instructions? I'm not naming the school, but from my school I did receive a form, and that form said that there are certain set of guidelines, that this needed to be signed by the child. So can a 4-year-old child be taught, be educated, and can I expect this child to actually follow these guidelines? Now the school may have a mechanism where the school monitors, and I'm sure there is a big, because we have our authorities in place and they have mandated these regulations, and I do respect that. But there is also a sense of ownership that comes in as a parent. I'm worried. Can my child follow these? What if my child interacts or contracts this from somewhere, not necessarily in the school? It could be in transit, it could be on his way back, but he was out from this cocoon where he has been in this last 5 to 6 months. So that is one of the concerns which I'm sure many of the parents have, and let's hope at least by the end of this discussion some of those concerns can be alleviated. We have the respective panelists from the schools, from the hospitals, from the medical sector. We have the psychologist on board, so probably even my concern could be these are my main challenges which I would like to highlight.
Thank you for sharing that. I think that you raised two very, very valid points. I'm going to go straight to Purva. You said no too about children going to school. I want to know how children are feeling at the moment, because from the poetry, it seems like children are raring to go to school. So you, as someone, almost the voice of the children of this country, why do you say no to this? I just want to know your thoughts on that.
So again, basing my opinion on whatever I've been reading and the interactions I've been having with the kids. Now, while I agree with what Judy said, and I agree that all the authorities are doing everything possible to keep them safe, and that's what I've been, and we've been telling them that, if a decision has been taken and you are going back to school, or whether you're staying at home, be assured that everybody out there is doing the best to make this a smooth process for you. But as Sangeeta pointed out, that this is going to be another adventure. And from what I have gathered is that they have already had an adventure in the last couple of weeks, getting used to this whole maze of all the things that Gigi pointed out, from younger siblings at home, from background, from whether should I wear my school uniform for this class or whether I should not make, how do I upload my homework as a PDF. So they've already had one adventure. And on the basis of all the poetry, the artworks, and everything that we are receiving, I think they are, at the moment, while they're extremely responsible, these tiny humans are, really aware, and they've been having these discussions with their parents. But they've also learned and kind of gotten to know the fact that, okay, if my dad is not going, there is a certain reason that he's not going. So even I don't want to go. And they are not ready for another roller coaster. So the whole thing of, a lot of these kids have attended these webinars which have been held by schools, and they have been overwhelming. You cannot fill your water bottle, you have to carry enough water, because you cannot shake hands in the school hallway. It's going to be a fist bump in the air. So there are just too many instructions. While yes, a lot of kids will be very good at following them, but yes, even as adults we do slip. And they are likely to slip because they're going to be so excited to be seeing each other one again and to be back in those classrooms. So they will be tempted to slip even if they're very careful. And so I'm not in favor of them returning, as long as the parents can, somehow manage it at home.
Okay. All right. Fair point. I'll come back to Gigi again. You've been, I think yourself and your wife both work. And you both have been working from home. This seems to be like the work from home culture is really taken on. And so you've got two working adults. And and you've got 2 children. So that's already about 4 laptops at home. I'm very keen to know, what is your work from home experience and homeschooling all at the same time? What did you have to do to set all of this up? I'm just very keen to take a quick comment from you on that. And has online working and schooling, has it worked for you? Gigi.
Sorry, could you just repeat that, Shireen? I just had a little bit of a disruption.
Okay,
could
so
you
my
just
question
repeat?
is this. Both of you, so that's yourself and your spouse, have been working from home, and your children have been schooling from home. So that's already 4 people on a laptop in your house. How have you made all of this work? What did you have to tweak, or how did you make this happen? Are you comfortable with this scenario right now and moving forward?
Okay, so definitely there had to we have a a technological upgrade to cater to this requirement. I'm not a tab person. I'm anti-tab. I've had bad experiences and with my children on tabs. So I'm a parent who's very cautious about the screen time that's been given to children. So having that said, I do have 2 laptops set up with headphones for my children. My younger one needs to be accompanied. So usually it's his mother or his grandma who accompanies him, because younger children tend to be very fidgety and their attention span is much shorter. I do have a camera to monitor the environment, and it's a voice cam. So depending on who's available, being my wife, we tend to just peep in and give. If we see that the children get up from their desk and they're going and troubling each other, we do give sort of voice commands. If there's a disruption, sometimes they tend to hear me more than my wife, or vice versa. But yes, this has been the sort of environment, and then me and my wife we confine ourselves to different rooms because we have our own expectations from the places of work, and we do take turns to come in to ensure and inspect and ensure that the classes are happening without much of disruption. Fortunately, the schools are also very understanding on that front. It's not like you're having a back-to-back 5 hours where they are occupied with their session. So the schools do share with us well in advance what is the classroom timings. They have provision for the breaks in between. There is enough activities where they do without their screen time. So there has been a sort of a mechanism that has been working quite fine. Now since there is this screen time that's been given to them, I have pretty much eliminated all other screen time that has been or that was being offered to them before, and I believe that is very key. And what I have done as a parent, is I have introduced all of our childhood games. The Monopoly has come back, the Snakes and Ladders have come back, the Caroms have come back, train tracks have come back, chess have come back. So how we have kept ourselves busy during our younger days when we did not have the luxury of screen time, this is what they do, and I've seen it to have very positive impact. My 10-year-old is able to play with my 4-year-old. I can see that my 4-year-old is playing Monopoly. I mean, come on. So this is sort of a very interactive.
Something's working.
Something's working. So
yeah.
this kind of an engagement, and what I have done in my home is I have introduced play currency. So I have a rate card which is hung on my wall, and there is a rate card for doing exercises. There is a reward for doing writing, for reading, for playing Sudoku, for playing. So these kind of activities, they do get points, and we do a barter system where if they want to watch TV, they have to pay me a certain currency. If they want to eat chips or a chocolate, they pay me. So wherever what we consider in today's norms to be the little evils, they have to pay for it. But they do good, they get rewarded, and we try to, because we don't have the luxury to go to a park or to the beach, so they exercise for half an hour and they get like 200 currency. So it's and this sort of a mechanism.
Your own
What about you?
System. Yeah, look at that.
What about you? You
So
are hypertensive and sitting at home.
Yeah, yeah.
Oh yes,
Okay.
me too. That's the other challenge, right? So now we do exercises together.
Really?
So that's fun and
It's a serious issue for you. You are hypertensive and you are sitting in front of the computer. You should watch yourself carefully.
I
Be
like it.
careful about that.
Dr. Sally's giving me
Yeah,
advice,
I'm
but I
not
want to.
happy with you.
Okay.
But
We'll come
since you
back to
made
you, Dr. Sally.
Sharif,
Yeah, I
but
wasn't
since she
happy.
made that statement, I'd like to say
Yeah.
that I used to walk and work out, and I did put on weight
You
during the
should. You
initial part
should
of
walk.
the pandemic. But since I've started this activities with my kids, I've actually managed to drop a few kilos
Excellent.
because they like me to work out with them, or they like me to play
Exactly.
with them. So this
It's it,
within the confines of our boundaries, we've tried to do what we can.
no, but
But
that
thank you,
really
Dr.
gives
Sally.
you, yeah, but that really gives you a chance to be a real role model. It's not always about the parents saying do this, but it gives you a chance to be a role model and to have a more engagement in the development of your children, and going back to some
That's
of
true.
the
And
skills
I
that you're
think every
introducing.
parent at this point of time.
Yeah. Sharif, I'm going to come to you now. So
You mentioned a very
technology.
key word. At this point of time, probably children have spent 6 months.
6 months sitting at home. It's not. Okay.
Gigi, I'm going to take a comment from Sharif. You really believe that technology is an enabler. It really is, because this webinar itself runs on technology. All of online learning runs on technology. Technology has really helped us in this pandemic, and it will, moving forward, be the key enabler for us. What are your comments on that in terms of how you've seen the evolution of it and right now and moving forward?
First and foremost, technology is not going to prevent this pandemic. It's going to actually prevent the impact of it. WHO has come out or labeled a term called infodemic, like pandemic. Infodemic means false information. In today's world, what you're actually seeing is there's a lot of misinformation that has been spread, in terms of the vaccination, fatalities, government policies, and things like that. What it leads to is chaos, price rise. This is something that we see across the world that's happening there. So technology, at first point, what it does, we call it data analytics. We ensure that the information is available to all the people so that right decisions can be taken. Today we have the data. Any of us who want to know about each and every country, you can log into the WHO website and get this information there. So I think that's one area that we've been working to ensure that information is spread right. Also, like how Dr. Sally, on the webinar, she's sitting in the nurse's station, most of the frontline workers are taxed with the workload. Technology is also helping them in those areas. For example, we call it robotic process or automation, RPA, where chatbots is a part of it. And chatbots, what it does is it helps you in automated admission process, diagnosis, and things like that. You got telehealth, where remote diagnosis is possible. We've also got robots now doing sterilization and sanitization process everywhere. Drones are being used for medical supply and things like that. So technology is actually helping the frontline workers to see how we could contribute to that. But coming to the topic of how technology helps in education, the least that it does is basically these high-speed internet that we give them so everyone is connected there. But what it also does is much more than, for example, if we are in the online session and a combination of artificial intelligence and analytics, what it would mean is, we could look at the attention span of the children, combine it with the earlier marks or some quiz that we do, we will be able to understand how this person is faring. And therefore, this allows the teacher to give more personalized teaching to him there. These days, when there is mixed reviews of coming to school, what about examinations? How are you going to conduct examinations there? So we have this remote proctoring. We still have this the combination of facial recognition with sound detection, what we can do is actually ensure that all the examination can be held remotely with all the same things that we do there. So today, what we're trying to say is technology not only gives you high speed, but it also helps in improving education. In fact, I would say it has actually taken education to the next level.
Okay. Thank you, Sharif. I'm going to go straight now to Kiran to find out how teachers are feeling about going back to school. And you're teaching at the university level, so I think you're already quite set in your online teaching methods. How are teachers feeling about going back to school?
I think Sangeeta touched upon this earlier in that we are all feeling very overwhelmed in transitioning all of our materials to be able to be delivered online. I think also the approach that my university, Harriet Watt, is taking is we're doing a responsive blended learning approach where, one, it's allowing for us to be adaptive as things are going on, because as we've seen in some other countries where they've opened up schools, there's been an outbreak and then they've closed them again. So even with all our brilliant planning, we don't know what is going to come up in the future. So we're being very mindful around, no matter what happens, how would we be able to quickly adapt our materials as we needed to. And it's also allowing for both face-to-face delivery and online delivery, because even if our students wanted to come back on campus, and some of them do, we've got students who are not in the country because of borders being closed and all sorts of other factors. So not every student is able to be on campus. So we have to be mindful about how do we make sure that no student suffers from any disadvantage by not being able to be physically present. And then the last one is about that customizing and tailoring for each course. So I teach psychology, and so compared to other courses and other materials, psychology is a bit easier to transition to online delivery, whereas we also teach various forms of engineering and textile and design and stuff, and they require, you know, more face-to-face use of lab materials and everything. So we're also having to think about, because of the restrictions in terms of social distancing, the number of students that can be on campus, who are we going to prioritize so to allow for everybody to have as good and as engaging a learning experience as possible. All of that on top of everything else that teachers have to do. So it's a huge amount of work. I think teachers are doing a brilliant job. I think as a university lecturer, I'm at least lucky that I'm working with a group of students whose development and their prior learning experience means they are quite comfortable with online delivery. But if you're a preschool teacher or these really young children, children with determination, all sorts of things, you know, they have a way more difficult experience than what I'm going through. So teachers are the heroes of this, and frontline workers as well. But teachers are doing an amazing job in having to just constantly be looking at, okay, here's the latest information, this is what we're learning. We're learning now that, again, you know, experiences like in the US, for example, where it's, you know, first we thought, oh, kids aren't that effective in spreading the virus, and now new data's coming in and we're like, oh, actually maybe they're worse carriers than we anticipated, so therefore what do we do about that? KHDA is having to take in this new information and adapt the guidelines that they're giving schools and universities. So great respect to all teachers, but I'm very mindful of the younger the student is, the more difficult it is to deliver materials online, because they just haven't had that, they're not developed yet. Their impulse control isn't as good, their consequential thinking is not as good, their executive functioning is not as good. And so we need to be prioritizing certain age groups and children with certain needs in determining how we're going to move forward.
Thank you, Kiran. That was a very well-rounded answer. I'm going to go straight to Sangeeta. We haven't heard from Sangeeta in a bit. And this relates to your school reopening. Now, in July, we all know that the KHDA released a 118-point COVID compliance protocol. And I understand that your school, the Amity School Dubai, has ticked off all of those guidelines, and you're COVID compliant now. I just want to know from you, what are the key or the main pointers in your school readiness plan? Just the key points of your school readiness plan.
Children have been out of school for 6 months, right? So there's this uneasy feel that all of us have. Gigi, Purva, that poem that you read gave us an indication that there is a restlessness and there is a desire to express and to move on. Now, with the government, the MOE and the KHDA, because we are located in Dubai, we were given protocols the minute the school shut in the first week of June, 118, as you said. All these are divided in 4 areas, 2 of which are related to the admin setup. One is safe operations. So Gigi, if my school is safe, you as a parent might consider sending your children to the school. Out of those 118 protocols, we were inspected to the finest detail on classroom locations, on all kinds of child-friendly display, on equipment that was installed, on the readiness of our clinic and our isolation room. All contingency crisis management procedures, standing operation protocols were all very clearly viewed and scrutinized. And we as a school went on, I would say, went berserk. We did everything that we wanted to do because we wanted to learn out of it. So looking at safe operations and looking at health and safety, which is priority and paramount, we are ready for the 30th of August. The only case where we are not ready is how are we going to address the specific psychological impact of a child in coming back to school after 6 months. There's been this learning loss. So as far as protocols are concerned, as far as procedures are concerned, as far as putting in an exit entry policy, a screening format, educating the entire community on what expectations are, I would say we are ready. And we were inspected for the campus readiness on the 19th of August. That was Wednesday last. And he said, you're compliant, please go ahead. And now we're so happy because we've got that confidence. So COVID confidence is important. And oh, COVID, we will learn, but we must overcome, because children can never ever be having teaching instruction replaced by a screen. There's social requirements. Much as you are getting your child to play Scrabble and Monopoly, etc., the organic experience of real teaching can happen with the children's friends, with the child's teacher, in the school, through a bus journey, in the classroom.
Thank you, Sangeeta. I think you raised some very, very valid points, and that really nicely segues into getting some of these parents, ready to get their children back to school. And Dr. Sally earlier pointed out that before the child is actually back to school, it is important for the child and the parent to visit the doctor. Dr. Sally, can you tell us why it is important to visit the doctor before they go back to school?
Yeah, actually, first of all, for the kids, because we need to check the general health situation for each child. Okay, we need to check their weight, their vaccine, if it is up to date. Okay, and then we will give advice about the immunity. We will give them advice about the precaution they can take. Okay, and you will give any supplement they need. Like we will do like assessment, physical examination, and with assessment for each child. Okay, and then we will prescribe what is important to increase their immunity. This is number one. And then for the psychologist department, because there is still kids, they have fear to attend the school. So first of all, because of the media and this, there's, as I mentioned in the beginning, there is more serious things, okay, than this, from the side effect of sitting online and studying online. Because if you're for adult and for children, you can't imagine the cases I'm suffering from, okay, and all with full respect for the hypertensive, for the diabetes, for the cholesterol. It's I can't tell you, it's disaster comparing with the 6 months ago, like the record. It's really serious effect of sitting online and studying or work for the adult online. Secondly, they should, for the parents, they should know, like all the school, they are taking the measurement and nobody can open without the instruction and following the instruction from the DHA, okay? And plus, like they should deal with it. It is a virus like any other virus. So there is precaution they should take. It is not will transfer on the air. It's not nothing like that. Okay, it's like by plus like there is a certain things measurement. If any on the admin department, when they enter the school, once they enter, they will check the temperature, and there is the staff nurse and also the teacher, everyone, they will watch if there is any child cough or they have any symptoms. Nobody will allow them. They will take them immediately. They will phone the school, and then nobody allowed to enter any place, not even the school with a fever, for example. And this is a very important sign. Okay, and then at the end, like we cannot keep our children in a bubble. They are exposed to everything, and it is not like a transmission in the on the air. It's like should be it's air droplet or contaminated surface. So all the precaution is taken, and also we should encourage them about the to increase the immunity, because this is a question like every day the parents, they are asking me in the clinic. They said how we will increase the immunity. It's not only to take vitamin C or to take vitamin D or A. This is important, of course, but the most important things like they should eat healthy. Okay, they should have a proper sleep and also the personal hygiene. This is all important things to be considered. Okay, and now also we are doing in the Prime Medical Center for each children, we are doing the full blood count, like because you are checking the hemoglobin and the iron, and we are checking the white blood cells, red blood cells if there is any infection. We are checking the vitamin D and vitamin A. This is important things. But as I said, like there's important things like increase the immunity than only taking the supplement.
Great, thank you so much. I'm going to go straight into that topic, which we touched very briefly on, the psychology of COVID, in the sense that children are, and even adults, anxiety, fear, all of this is on the rise. This question is to Dr. Kiran. I'm quite keen on your thoughts about how to deal with all of this anxiety and depression that both children and parents are going through as a result of this pandemic. What are your thoughts on that?
Ooh, that's a big question. You're right. There is a lot of anxiety and stress and concerns around COVID, that's you know, COVID has just sort of permeated everything. So even if it's kids are concerned about what's it going to be like to go back to school, but then they might also have heard, you know, oh, is their dad, is he going to lose his job? If he loses his job, am I going to have to leave Dubai? Am I going to have to make new friends? Where are we going to go? What if I bring something back and I make my grandmother sick? And then, you know, something happens to her. How am I going to cope with that? So it ripples out to everything. And I guess, you know, what do we do about that? It's a hugely complex issue, and I think, you know, bringing in as many stakeholders as possible just to coordinate with that is very important. I guess if I was going to give sort of two broad guidelines in terms of confusion and messaging, we have to be really, really mindful of how we're communicating things to different stakeholders. When you are telling children what it is that's going to happen, everyone needs to be very mindful around, am I communicating this information in a way that's developmentally appropriate for this child? Are they going to understand that? I've seen some really good resources being released by child psychologists where, you know, they're creating little storybooks and things online as to how to explain issues to children. And then it's the same, you know, children, you've got to think about what's developmentally appropriate. Let's say with parents, you've got to think about what are their main concerns here, and am I actually targeting what their primary concerns are in the messaging that I'm delivering. So communication needs to be as regular and consistent and transparent as possible to try and alleviate that confusion. I also agree that with what Sharif was saying around misinformation, we have to also be careful around like what's this distinction between misinformation, where it might be something is being deliberately construed in a way in order to fulfill some agenda. So there's an attempt at deception there, versus portraying information that we think is correct at the time, and then new information comes in and we go, oh, we got it wrong, and we have to adapt what we're doing as a response to that. If you're not doing that well, then it can undermine people's confidence in what it is that you're telling them. So if we take the issue of masks, for example, again, I think overall in the UAE, people are very respectful about adhering to masks, but you've seen in other countries where people go, oh, you've told us so many different things, so I'm just not going to believe anything you say anymore. So that's one element, is how we're managing communication and the communication channels that we use. So if I'm working with a parent or children, what I often will tell them is, you know, pick one or two sources of information that you trust and go with that. So you might want to, how are you learning information from your school? So how are we getting that? And then maybe one or two other sources of information, and just go off that. But if you're just following random people on social media, for example, where the information is not peer reviewed or scrutinized at all in terms of its objectivity or accuracy, then that's going to create additional anxieties for you. So a big one is communication. And then the other one is around when it comes to anxiety. So with my clients, we'll do a lot of work around, you know, what is within your realm of control. So if we can identify the stuff that's within your control, let's focus on that. The stuff that's outside of your control, let's develop skills so that you feel like, well, whatever happens, I can adapt to that. Can I roll with whatever new information comes to light? So if we take something like kids going back to school, parents will want to be thinking about, what is it that I have within my control here? So it might be, what limits am I going to set in terms of kids' screen time? Gigi's stuff, I was blown away. I thought some of that was really good around, well, if you're going to have all this screen time for school, we need to be mindful about limiting the rest of your screen time. I can control that, ideally, you know, with nice parental ways that we do that. And the reward system that you were talking about, that's really nice. Whereas what's the stuff I can't control? I can't control what it is that my school decides to do in terms of how they're going to implement things. What I can decide is how well that suits me and the needs of my family. So it's helping people identify, in my control, let's focus on that. Outside of my control, that's annoying, and I might wish that was different, but that's the situation that I'm in right now. So how can I best accept that and kind of roll with that, knowing, again, in terms of resilience, whatever happens, I will cope, my child will cope, the family will cope, the school will cope, the teachers will cope. So those are the two broad messages, I would say.
Thank you, Kiran. Yes. I just wanted to quickly take an example of how it is that maybe I'll take a quick example from Sangeeta on how it is that they're communicating. Just one example from you on how you're communicating to parents. And Purva, I'll take one short example from you on how it is that you're communicating to children. Just two examples. Sangeeta, you. Go ahead.
So, parents are our main stakeholder. And in this situation, more than ever before, we need to walk together, hand in hand. We have designed very special guidelines for parents before joining school or before reopening school, which is different. We've sent them across. Today, I have sent a special set of guidelines which moves a step closer, which is part of opening. And once we begin school, maybe in the second week of September, we will set another set of guidelines. So guidelines in terms of expectations, in terms of answering a whole lot of FAQs. For example, why should you send your child to school? We've just put in a whole lot of processes in place to understand so that you get all the information. Yet we respect your decision. So parents have been given very specific guidelines on all the protocols. For example, in the morning, you are expected to take the temperature of your child before your child boards the bus, or your child should be checked for any of the symptoms that could be for COVID or anyways, and do not send your child to school. So that's a normal everyday morning guideline that we've shared with you. So this way, we do not flood you with too much, but thoughtfully, mindfully, because we've got so many parents also on our school leadership team and our teachers, we have appropriate, targeted communication, which is comprehensive. We hope that we do not leave anything out. And for children, child-friendly, absolutely child-friendly.
Okay, Purva, I'll take a quick, thank you, Sangeeta. I'll just take a very quick example from you, because I do want to cover two very important topics before we get into the Q&A. There's lots of questions.
So in our case, what we have done is, like around four months ago, we started something, a hashtag called Talk to YT, and we said, irrespective of how you are feeling right now, we are here to listen to you. So even if you are extremely joyous about the fact that you are now at home and you can probably sleep 45 minutes extra, or you can make faces in a Zoom class, we are listening. Or even if you're very anxious and you feel you need meditation, we are listening. So that's one very important aspect. Second, of course, we encourage them to express in every way possible. And they have been, like Gigi said, it's amazing how many DIY projects and bloggers have come during this time, because they have using it to express how they are feeling. And third, this actually came from them that, they are more comfortable when they're interacting with their peers. So if I'm going to tell them, watch this movie, it's good, they're not going to believe me. But if the friend is going to tell them, then they'll definitely watch that movie. So we've made sure that they are still communicating with their friends, and of course a lot with their teachers, because if ma'am says this is the correct spelling or this is the correct pronunciation, then even when we were kids, we would fight with the parents and say, no, ma'am has said it, so it has to be right. So what Sangeeta said, that if I'm a student and if Sangeeta is telling me that, listen, come back to school, this is safe, I know Sangeeta ma'am is right and I'll go back to school. So that's like, we've just done it in such a way that the communication and just share what you're feeling continues.
Okay, thank you, Purva. I just want to get into a very important topic. I want a brief comment from you, Sangeeta, on in the case that you have a COVID occurrence in the school, you have a crisis. What is your crisis management protocol? What have you set for your school? I just want to quickly get a comment from you on that one.
Very quickly, we've got a very stage-wise contingency plan. This involves what is known as a crisis management team, who is vigilant, who is there on the ground. The minute we have somebody, a staff or a student with symptoms, we have an isolation room with all the protocols that are required and substantiated by the Dubai Health Authority. The child is escorted there. The doctor and the nurse get in touch with the parent and inform the parent. The doctor and the nurse then also inform the DHA officials. There is a proper government protocol which we follow. All equipment, all isolation spaces, the movement and escort is also written down and followed to the T, because that's the area of highest priority.
Thank you, Sangeeta. Now, back to Sharif. Your company recently launched Wai-Eye. It's an AI-powered mobile app designed to equip schools to meet the new COVID-19 health and safety protocols. From what Sangeeta is saying, can you tell me how this technology is going to help schools maintain their COVID compliance?
Yeah, in fact, I was actually noting down the points that most people were talking about. Key words that came out is, Dr. Corinne spoke about this information. She quoted me, obviously. Then communication is something that someone spoke about. Guidelines is something that they spoke about. Safety. And then the last important point was the crisis management. So I guess these are the important things that everyone's talking about. Let me get into Wai-Eye. Wai-Eye is an AI tool, which typically is a web and a mobile app that is used for COVID compliance. It's a very simple to use app. It connects to your existing CCTV infrastructure. I'll make it very simple how this whole thing works.
Do you mean at home or do you mean at school?
Yeah, existing CCTV infrastructure at school. Just
Okay.
we connect to them, and then we are good to go. What can we do with Wai-Eye? This is how it is. When a student or a teacher enters, so Sangeeta spoke about entry and exit. When they enter in, our system will take care of the thermal reading, and therefore the temperature is checked. We have a facial recognition tool, therefore the attendance is marked. We also ensure that the mask is being done. So what it happens here is, as Gigi was mentioning, whether how I as a parent would be worried about all these things. At 8:30, he would get a message in his mobile phone saying that the school is safe, everybody's temperature is being checked, and attendance is also being marked there. And let's assume that the students are there in the campus. The most important thing that we need to look at is the sanitization process. These children will move from lab to the library, the restroom. Every time there's a movement that's happening on, the place needs to be sanitized. And that's one of the guidelines that has been given by KHDA and Ministry of Education. Now, what most of the people are doing is manual way. They would have someone sit there to ensure that it is being done. But we are the eye. Wai-Eye is using the existing cameras. We will send alerts to the supervisors saying that, what, sanitization needs to be done. And therefore, the process that what is being said by the regulators and governments is met. Now, it is not met, it is met with data. When did it happen? How did it happen? And things like that. So including your physical distancing, occupancy levels in different areas, in the lab and library and the classroom, is using our heat wave technology. We ensure that it is all met there. She mentioned about the important point about the crisis. And in crisis, what is more important to know is also to look at the contact tracing. If there was an incident that happened, we need to find out, who are all the people that they were in touch with. So, our system will clearly tell you in the last 1 day, 2 day, 3 day, whom all did they touch base, whom all they've contacted. So the entire detail is there. And this is something that is required by the government and the Department of Health as well. So these are very important data points that we collect and give it to them. Now let's assume, not assume, the next point is when student or the student goes out of the school, we have a very secure child pickup system. So we would now know there are two ways that the child gets picked up. Either the parents or the guardians, someone or the driver comes and pick up. We validate who's the right person, what time did he come, and was he checked for the temperature. That is also captured and sent as a message to the parent. He knows that at what time he has been picked and temperature has been maintained and things like that. In case they are using the school bus, we have a GPS enabled. So all your GPS, the sanitization, the mask detection, the occupancy levels are all monitored. And a message goes back to the parent saying that, the child is going to arrive at your place in 5 minutes time. So what Wai-Eye in short does is, typically, if for Gigi as a parent, he gets his peace of mind saying that the school is a safe environment for the kid to go in, and he gets the data for that. For the school administrator, Sangeeta, what she gets to know is that all the processes that we need to follow as specified by the government, we have followed it, and here's the proof, here's the data for that.
That evidence is important. That evidence is extremely important because you cannot, mismanage a process there.
Absolutely. So we ensure that the processes are followed and give you a data for that. So that's what, in short, Wai-Eye does. Wai-Eye is the AI tool for safe and a safe and secure environment in the school.
Okay, so that's technology to the rescue. I'm quickly going to the Q&A. We've got a lot of questions. Some of them were technology questions, and I think they have been answered by Sharif. Thank you for that very detailed answer. I'm going to take a question from Deepshika. She asks specifically to Sangeeta, what changes are you bringing in now in terms of the method of teaching in the school? Is it the same as earlier? or is there anything different?
Pedagogy has completely changed. We have a beautiful crafted blend of digital and online teaching using a whole plethora of tools and techniques. So there is nothing that you can even resemble of what we did in the past, except for basic deep diving into content. So there is a huge focus on skills. There's a huge focus on personalized learning. We need to use a lot of blended tools for that. I'm really happy that somebody is asking me, are you going to even look at what traditional teaching was? Definitely not. We really crossed the path to a lot of progression. And that's fantastic. That's amazing learning. And to get through all those pedagogical skills and techniques, get in touch with me. I'll give it all to you.
Okay. I just want to quickly take the first question that was sent by Kalyan Krish. So basically he's asking the question, who takes this responsibility? Who decides when children can be at school? Is it the school? Is it the government? Or is it the parent? Who takes this responsibility? Or is it a collective responsibility? Can I just, whom should I ask this question? Tough one. Kiran, maybe I'll ask you this question. Who should take this responsibility? Should it be the school, the government, or parents?
I think it's a very top-down model in the way that it's working. So the government determines, here's some broad guidelines that that schools need to try to implement. Then the schools have to work out, well, based on these guidelines, what is it that's feasible, practical, possible in terms of financial resources, and then they implement that. The final decision, in my opinion, does come down to the parent, because every child is going to be different and every family has their own unique circumstances which they need to manage. And then ideally they are making that decision in consultation with the schools around how that is going to work. And hopefully schools have that adaptive process. So Sangeeta was talking about that there's a blend. The question for some parents would be like, let's say you're offering 1 day a week on and 2 days off. What if that doesn't work for me? Then how can we adapt that? So yeah, it's a flow-on process, and all of these different stakeholders are consulting with each other. The ultimate decision, I would say, comes down to the parents. But hopefully they are making an informed decision.
That's what this is about.
Based on good information from all the other stakeholders involved.
I guess the confusion is because this information keeps evolving. I think that's where the confusion comes from.
And having said that, ideally you would also want to involve the child in that decision-making process, because if decisions are being made around them, then you're less likely to get buy-in from them, and that can stem confusion. So again, in terms of what's developmentally appropriate, but explaining to the child, like, here are your options, this is what this would look like, this is what this would look like, which one would you like? Again, you would like to think that schools are going to adapt, where maybe a child might start off with one format and then they find after 4 weeks that that's not working for them, or their situation or their circumstances change and they have to adapt again. Hopefully schools have that flexibility to allow that to happen. So hopefully, yeah, it's a joint decision ultimately made by the parent, but in consultation with the child and the other stakeholders involved.
Thank you. That was a very diplomatic answer. Covered everything. Kalyan Krish, I think I hope she's answered your question. I only have time for one more because we have to round up. It's almost time. My last question is about vaccine. It's from Ajit Kumar. He says, if the vaccine is out, how will the schools and offices monitor the individuals on fighting COVID? I'm not quite sure what he means, but I suppose it means, how do we ensure that everyone gets that vaccine? Or Dr. Sally, I will let you answer that question before we round up.
Yeah, actually the vaccine is not yet here in Dubai, so I don't know why they're asking about this.
No, I mean, I guess eventually the vaccine will be out. So in that scenario, are people in terms of okay.
This is optional vaccine. No, it's not mandatory. It's a new vaccine, so I don't think like everyone will accept to take it. You know.
Okay.
Yeah, but what I'm advising for them, for the parents, because the flu vaccine is very important to take it next month from September, like it's 1 week from now. The new vaccine, the flu vaccine is coming. So if they are not taking it within one, because it's annual, it's once a year. So they should take it. They should give it to their children. It's mandatory. But for the COVID vaccine, it is not yet in UAE.
Okay. Unfortunately, that's all the time we have for Q&A. You have asked a lot of questions. I'm going to share with you an email address that you can send your questions to, and our panelists are very happy to answer them. The email address is media@gt.technology. There you go. I've put it in the chat. So please address your questions to media@gt.technology, and we'll ensure that all your questions are answered. So I'm going to close now. We're going to send a poll. We have another exit poll, which I'm going to ask my colleague to launch right now. And in the meantime, I'm also going to take closing remarks. We'll start with Purva. Just a quick 30-second closing remark from you.
Well, mine would be, yes, we cannot bubble wrap our kids. So let's empower them with the right information, use the right words, involve them in the decision. And if a child comes back home saying, oh, mama, I touched the tap today, please do not panic. Tell them it's okay, you touched it, next time be careful. Involve them in the decision. Yeah.
Thank
Definitely.
you, Purva. Short and crisp. Sangeeta, closing remark from you?
Well, it's a next new normal. Learning must continue. The momentum in learning must continue. And let's encourage all organizations, all stakeholders. Let's do it together.
Thank you, Sangeeta. Dr. Sally, a closing comment from you. Your last note, your sign-off, parting note.
Yeah, but actually, they miss, for the parents and for children, I just encourage them to visit their pediatrician or the family doctor, so they will have full knowledge about what's going on, the proper advice they can get from the doctor, and as I told you, all the required vaccine, all the advice they can get, so they will be safe and sure before they send the children.
Thank you so much,
Which
Dr. Sally.
I'm encouraging 100%.
Everyone needs to go to school, according to Dr. Sally. Gigi, I'll take a quick comment from you. You need to unmute your microphone.
Yes, I just have 2 points. One is be the ideal role model that you want your child to follow. The other is we all want our children to go back to school. So, and we know that it's going to happen soon. So make best of whatever little time that's left that you have with your children uninterrupted.
Lovely, lovely.
Dr. Kiran, your turn.
So I would say make sure that we acknowledge and validate everybody's perspective in terms of their emotional experiences as we're dealing with this. We want our decisions to be based on data and on evidence, so not anecdotal stuff, not intuition, because our intuition is often wrong. So technology like Wai-Eye is really good in collecting that data and implementing decisions based on the evidence that we've got. But also everybody's responses to this is going to vary on a huge spectrum, and we need to be respectful of that and help people validate their emotional experiences in helping them to decide what's best for them moving forward.
Thank you. And I'll close obviously with Sharif. Your parting word, line.
Just give me 10 minutes, I'll call back my webinar. Sorry.
I'll draw a parallel with another outbreak. This is the tuberculosis outbreak in 1900. When that happened, Germany were the pioneers in terms of introducing the open air school, and rest of the countries followed that. So invention is the mother of necessity. So today, parents, researchers, teachers, government, everyone is working to create technologies, to create guidelines, to create processes, and all that to ensure that we have a safe and back to school experience. I guess that's what we want to do now. Thank you so much.
Thank you so much. Thank you everyone for joining us. Like I said, please, unfortunately, we couldn't take everyone's questions, and there were some great questions in there. I encourage you to write to us, media@gt.technology. It's in the chat, and I hope you have answered the poll, because that's going to be really useful for us to understand a change of perception, what your opinions might be. So thank you very much for joining us, and have a great rest of the day. See you then.
Thank you.
Thank you.
Thank you all.
Thank you, everyone. Thank you. It was a pleasure.